young patient, he is presenting with history of low-grade fever for the last few days, along with mild pain in this region, in the left lower abdominal quadrant and in the suprapubic region. Now let's see on the ultrasound what is the issue. Now I am at the umbilical region, longitudinal at the umbilical region, and you will see that as I come down, I am coming down from the umbilicus to the pubic symphysis. What do you see? This is the urinary bladder in longitudinal section, and this is a pocket of fluid-filled pocket, only 15 millimeter deep to the skin, with internal impact momentum or subcutaneous tissue. Rather, it is in the subcutaneous tissue. Why? Because if you concentrate on this, then this is the peritoneal line, this is the subcutaneous tissue, this is the skin, and this is only from this angle it's only 11 millimeter deep to the skin. Now it's a subcutaneous collection which is seen from the umbilicus to from just below the umbilical region. It is seen up to in the midline, in the subcutaneous tissue. It expands laterally. Now, because I am giving a sweep to the probe towards the left side of the patient, keeping the probe in the midline, and you can see that it's bulging towards the left side. This is, and so its maximum length that can be obtained is this. In transverse section, it's this. See the posterior wall acoustic enhancement because of the cystic area, on the fluid-filled area rather. The fluid-filled area gives posterior wall enhancement. So it's measuring approximately 8.7 centimeters in length by 4.3 centimeters by 1.4 centimeters, and oh sorry, let's do it again. Approximately 9.1 by 4.0 by 5.8 centimeter, and its approximate volume is 113 ml. However, when it surgically it will be explored, the volume will rise. So this is a collection in the subcutaneous tissue, seen just below the umbilicus, and then extending up to the symphysis pubis, and expanding laterally with an approximate volume of 115 plus 115 ml plus. Okay, now we have to determine that does it have any connection with the intraperitoneal regions, parts, organs. Now urinary bladder is seen absolutely normal, no wall thickness. This is the urinary bladder. No wall thickness, it's longitudinal section, and here you will be seeing the prostate. This is the seminal vesicle in longitudinal section, and this is the prostate of the gentleman. And we can see the collection anterior to it. Come upwards. Now little towards the left of the midline. I want you to note one thing, that this is the peritoneal line, this one, this line. See the movement of the bowels below the peritoneum, and with dirty shadow. These are bowels, this is bowel, this is bowel, this is bowel, all giving the shadow, and you will see movements in them. Whereas there is no movement in this fluid pocket and this ecogenic material contained in it. You will see no movement in this area, in the subcutaneous area. However, you will see movement of bowels in the posterior to the peritoneal line. So it's not an intraperitoneal lesion. Here you will see it is in fact a collection, an abscess, most probably an abscess in the mentioned region in the subcutaneous tissue, with no relation with the intraperitoneal organs or parts or bowel. Now we should at least see that does it. Okay, let me show you this in magnified view, that there are septas. These are septas, tiny calcifications within it. And this is the transverse section of a magnified view of this subcutaneous collection. Okay, let's see if it relates to the left, what is the condition of the left iliopsoas muscle and the kidney. This is the left kidney. There is a small calculus seen at the lower pole giving posterior shadow in the left kidney, but this strap of muscle is the iliopsoas muscle, and I am going to explore it up to maximum where I can, so that we do not see the abscess or the collection in this region. This is the peritoneal line, and so no relation with this left iliopsoas muscle. Once again, a repetition. Now this is the muscle. This is the outer boundary of the muscle. This is the strap of muscle. Here I am going down now. This is the external iliac vessel. So actually no connection of with the source. So no chances of pleural, source abscess. No pleural effusion is seen, as you see on the right side. Now you see that there is, well, here we do see the dilation. This is the lower pole of the right kidney, middle region, upper pole. You see claw-like dilation of the calyces, hydronephrosis, and the dilation of the ureter as well. As it cannot be followed more than this, the bowel gases intervene, and you see that this proximal ureter is measuring 8.8, so more than 7 is considered to be dilated. So there is hydronephrosis, the parenchyma is preserved, thickness is preserved, echogenicity is preserved, corticomedullary differentiation is preserved, there is no calculocin within the kidney, no focal lesion, both poles are clear, and there is hydroureter. Now what about the source muscle in this region? Here you see it again, this is the right iliopsoas muscle strap that is in front of you, this one. Here we come, this is the lower end of the source muscle. So no relation with the source muscle. What about the para-aortic region? A lot of gas in this region. Yes. So coming back to the primary pathology, this is a subcutaneous collection. We see that this is a case of subcutaneous collection with, that is an abscess in the mentioned location with right obstructive uropathy